It's time for another segment of Mr. and Mrs. Medicare, saving seniors from a high cost of healthcare, debunking Medicare, making Medicare easy to understand for all seniors. All guests of any of the Medicare segments receive the free ebook written by your MedicareLady.com. Here are your hosts, Paul and Sarah Finkelstein.
Hi there, I'm Paul Finkelstein. I'm known as RealMedicareMan.com. That's RealMedicareMan.com. And my wife, Sarah Finkelstein, or Mrs. Medicare, is known as YourMedicareLady.com. That's YourMedicareLady.com. So you can see if you're on YouTube or LinkedIn, broadcasting at the top of my LinkedIn profile, or X, broadcasting over there as well. Going over 16 different chapters in this amazing book. We're on chapter 9 right now. The book is the title of it. If you haven't caught the other lessons, these are free Medicare lessons every single day, a daily lesson, a daily morsel about Medicare. Why do I choose a daily morsel? Because I did recognize years ago how to eat an elephant. No, no, not knocking vegans or vegetarians or carnivores. But to eat an elephant, it is suggested one bite at a time. If you give yourself too much information, you're going to get overwhelmed, start to overthink, overanalysis. And what happens to those people? They most likely do nothing. But in Medicare, you don't want to do nothing because, well, you'll leave yourself wide open for a lot of medical expenses and endless bills. But here's the name of the book, straight to the point. Finally, an easy Medicare education for boomers and seniors, the conclusive, clear, complete guide, make no mistake. Roadmap to Medicare. It's now here, brought to you by YourMedicareLady.com and RealMedicareMan.com. All right, to get to that part, I used up a whole 2 minutes. So let's better get cracking. But chapter 9 is, do all doctors accept Medicare? Tell me, is that a good question? Or what? Do all doctors accept Medicare? What do you think the answer to that question is? Perhaps maybe there's some doctors that don't, is what we're alluding to, but the answer is no. Most do, though. So you could put those fears behind you to a degree. But a startling trend of doctors who not only refuse to accept Medicare, but are charging membership fees just so you could see them. These may be called concierge type doctors. These fees range anywhere from, say, $1,500 per year to $10,000 per year, and sometimes even more. In June 2017, this is quite a while ago, there was an article in the New York Times about a San Francisco physician, Dr. Jordan Schlane, who charges a concierge fee of $40,000 to $80,000 per family just for the privilege of having access to his services. For most Americans, this is not within their budget, but bear in mind, there are more doctors that accept original Medicare than the ones who accept Medicare Advantage plans or Part C. However, Part C plans do have physicians in every specialty. But what are the premiums, the monthly premiums for a Medicare Advantage plan? Well, that depends on your zip code. Some plans have zero monthly premium and some have a small monthly premium. So when you're at one of our seminars, there's always people in the audience that are like, can you just give me a quote? Just give me a range. Just give me something so I know how much I'm going to be paying. But everybody in that room is completely different because the price is based on perhaps your health. Perhaps maybe it's based on your zip code. So your health, your zip code, and a few other factors. So all doctors accept Medicare? Show of hands. You probably know the answer to that question by now, and you have a little bit more insight in your free lesson about Medicare today with Paul and Sarah. YourMedicareLady.com, YourMedicareLady.com. Oh, by the way, at the bottom, you've been seeing in the scrolling bar, just rewind. It's very easy to find it. If you missed it, have no fear because you have the ability to just rewind. And this will be up, so we're not going to take it down on my YouTube, LinkedIn, or X. But there it is right now, easy button for Medicare.com, and you can get a copy of the book that I'm giving you your free lessons. Easy button for Medicare.com. That's a PDF download. Easy button for Medicare.com. Let's put up on the screen here the most commonly asked questions about Medicare. Thankfully, your Medicare lady, Sarah's very patient, and She put some commonly asked questions in the back of the book. I particularly like the number one first question that she put of several questions on the very first page of chapter 16, the last chapter in the book that I mentioned, the title in the beginning here. And that question is, what if I'm still working beyond age 65? I think this has got to be the number one question that I think I have heard. Show of hands, do you think that would be the number one question? What if I'm still working beyond age 65? Do I still need to go on Medicare? Well, that depends on the size of your employer. So it depends on the size of your employer. And if your employer has less than 20 employees, then typically, yes, it's probably advisable to go on to Medicare. At least Part 8, because you've probably paid into the system for the hospital portion. And you don't have to do the Part B, but if you have less than 20 employees, you probably definitely do. But you still want to consult with a Medicare agent. Call my wife, Sarah. She's standing by at 561-302-5760. That's 561-302-5760. If the employer has more than 20 employees, then you can stay on your group health insurance. That's probably considered a buzzword in the Medicare field called credible coverage. Here's another question. I haven't worked the minimum of 10 years. Can I still qualify for Medicare? So you do have to work 10 years in the United States as a citizen to get Medicare. Well, politics aside, you can qualify for Medicare through your spouse if your spouse has worked 10 years or more. So if your spouse worked 10 years or more, you qualify for Medicare that way. Now there's another section that we're going to get into, and that's about real people and real kindness. So we're talking about some real people and some real kindness. And if you're one of those people, we'd love for you to hop on the bandwagon as well and hear some of what you liked and what you learned about our Medicare programs. So what did you like about this Medicare program, this free morsel of a Medicare lesson, absolutely for free, a little bit every day, so you could be up to snuff when it comes to selecting which Medicare plan is best for you in the comforts of your home, our offices, or on Zoom. So you have multiple choices these days to have a meeting with Sarah, your Medicare lady, or Paul, realmedicareman.com. But listen to what Bill Patella said, because he's a real person. He's really kind, and here's his real testimonial. So Bill says, I have worked with Sarah for several years, and she's been a caring friend and a valuable resource in a sometimes scary world of personal finances. Her intelligence and knowledge in the area have a great benefit. I recommend Sarah highly to anyone in need of a trustworthy, devoted professional. So thank you, Bill Patella, as well, from Real People, Real Kindness, and Real Testimonials from Bill. Jocelyn Dillard, here's what she said. I met Sarah at a woman's roundtable and immediately felt the warmth and genuine personality. She's very knowledgeable in her field and cares for each individual's financial needs. Thank you so much, Jocelyn Dillard, about saying some real kindness about Sarah. You're a real person, and that was a real testimonial. Thank you so much. Elaine Karniski said, I wanted to thank you for helping us with a Medicare supplement when we lived in Florida. When we moved to Tennessee, you had to help us again, and this time with great savings. Our policy renewed last month with a 23% increase, and again, you helped us save money again, so it does pay to keep in touch with your Medicare agent, and Sarah is standing by at 561-302-5760. So thank you so much again, Arlene Korniski. We appreciate having you as and we'll gladly, she says, thank you for having us as an agent. Gladly refer you as friends and to your friends and your neighbors. Thank you again. Okay, reading is optional. All right, thank you so much, Arlene Korniski. So that's our segment on real people and real testimonials and some real kindness. Thank you so much, everybody, for participating in our free morsel of free Medicare education, a free lesson daily on Medicare. And I want to give a shout out to Tony from trcvoiceovers.com. Tony from TRC Voiceovers is the best voiceover guy on the planet. Tony Ramundo is the best voiceover talent on the planet. Well, check it out.
It's time for another segment of Mr. and Mrs. Medicare, saving seniors from a high cost of healthcare, debunking Medicare, making Medicare easy to understand for all seniors. All guests of any of the Medicare segments receive the free ebook written by your MedicareLady.com. Here are your hosts, Paul and Sarah Finkelstein.
Oh, you're still there? This is the very end, but don't worry. Every day we do another segment. This is our 9th or 10th segment already. Free segments all about Medicare. Free education about Medicare daily. I'm Paul. You can reach me at realmedicareman.com or Sarah at yourmedicarelady.com. And if you have some Medicare urgent concerns, just Sarah is standing by, my wife and better half, boss, etc., Mrs. Medicare. And you can call her at 561-302-5760. That's 561-302-5760. Thanks for now. Hope you're having a fantastic day. And here's the most important message of the day. Tomorrow is election day. Do not forget to vote. Tomorrow is election day. Do not forget to vote. Exercise your right to vote. Citizens, thank you.